Okay, so today we're going to be learning abdomen with Doppler. So obviously when you do an abdomen, your patient has to be NPO for the reason of the gallbladder. And it's just a better window to see when they haven't eaten. So I'm going to show you my approach and how I do abdomen with Doppler. So I am intercostal on the patient. You can see the rib shadowing right here. I find it best to do intercostal instead of subcostal, and I go up as high as I can with the ribs. So we can see I'm in transverse, we can see our IVC, and we can see our hepatic veins diving into the IVC. I'm gonna put my color on, I'm gonna fix my box. The bigger your box is, the more effort the sound waves have to make to create that color. So it's easier if it's better quality image if you make your box just optimally large instead of covering the entire screen, because then we're getting the flash. Obviously our diaphragm's moving with every respiration. We're getting pickup from all the other surrounding vessels. So we kind of want to hone in on what we're trying to focus on. We can also see that these vessels are changing color, right? And that's because with respiration, our hepatic veins, so this is, can you see my mouse on the screen? Mm-hmm. So this is our IVC right here, and then this is our right hepatic vein, and then coming in the center of the liver is our middle hepatic vein. How do I know that? Because if I, hold your breath please, if I scroll down, the hepatic vein is going to be in the same line as the main portal vein and the gallbladder. So I'm just going superior to inferior. You can breathe, I'm sorry. That's good. So that's how I know that that's my middle hepatic vein. So I'm coming superiorly. I can see one of my vessels coming in, and I swoop down and I can see main portal vein and then my gallbladder. They're all in the same plane. So I'm going to go back up a rib space and I'm going to see those vessels diving in. I'm going to put my color on. We can see that they're changing color, and that's because with respiration, hepatic veins are supposed to change, are supposed to go above and below the baseline. They're supposed to be triphasic with respiration. So I'm going to put my power wave, my spectral on, and hold your breath, please. I'm going to increase my scale, move my baseline up, and breathe. So that's a beautiful waveform. We can see it's triphasic. So it's 1, 2, 3, 1, 2, 3. The third is above the baseline. So 2 below, 1 above. That's very normal. Now that's with her holding her breath. Obviously it's a picture perfect patient. This patient does not have liver disease. So we can see those really pretty wave patterns. Now I'm going to show you what it looks like if she keeps breathing and we try to get a waveform. So see how we can see the value of our waveform is kind of changing a little bit. We're not picking up as much here. We're getting a little bit of noise, but this is a beautiful wave pattern. This is a beautiful wave pattern, and so is this one. And then we can see that this one's a little bit of a higher value, and that's because it's going to change with respiration. So ideally, you want to try and get it without them holding their breath, and you want them breathing so you can see the difference with respiration, but obviously sometimes it doesn't work out that way, and that's fine. So that was mid hepatic vein. I'm still transverse intercostal, really superior, almost near the dome, and now I'm gonna get right hepatic waveform. I'm gonna try it without her holding her breath. See how we can get a little bit of a waveform right here, but it's not pretty, right? So I'm gonna have you hold your breath. And breathe. So we're getting a little bit of artifact. I think that's because of her heart beating, which we obviously don't want to stop. I'm gonna try I'm gonna angle in a different direction. So I'm gonna slide a little bit more laterally and angle in. So let's see if that is a little bit better. Hold your breath. Much better. Breathe. Good. So that's right hepatic vein. Now, some people go subcostal on their patients. Big breath in. Some people go subcostal, so underneath the ribs, and you can see all 3 hepatic veins diving in right here. Breathe. Beautiful picture, right? But you're kind of far away from these vessels, and the left one can be a little bit tricky to find here as well. Although with a picture perfect patient, it's going to be easy. With those more difficult, kind of fluffier patients, liver disease, all of those factors, it's going to be a little bit more difficult. So I like to get my left hepatic vein in sag left lobe. Big breath in and hold it. So we can see it right here. Breathe. Oh, let me get a better one. Small breath, nothing crazy. Breathe. So this is my left hepatic vein right here. It's usually, you can sometimes see it from the IVC kind of darting into the left lobe like this. I'm gonna have you take a breath in, hold. Breathe. And again, we can see that triphasic waveform. So 2 below, 1 above, 2 below, 1 above. That's triphasic. That's a beautiful representation of a hepatic vein. Now for portal veins, I'm also gonna go intercostal again. Sorry, is that okay? Mm-hmm. I'm gonna put my color on at my main portal vein. Main portal, you want a velocity measurement, so you're gonna angle correct. I like to angle correct before I go. Some people do it afterwards. I just will have to make sure that my angle is correct. So the angle in your gait right here, this little angle, if I move it, can you see it moving? Mm-hmm. So that obviously cannot be above 60. We want to keep it as close to 60 as possible for the most accurate reading. So take a tiny breath and hold it. And I'm going to make sure that that's right in the middle of the lumen. And breathe. Beautiful. We're going to take a velocity measurement of that, and that would be your main portal vein. Now, because I'm right here, I'm going to do my hepatic artery. Take a breath and hold it. So I can see that it's straightest right here. Breathe. So that's not a bad waveform. I'm going to try and get a better one though. Breath and hold. Breathe for a sec. Tiny breath and hold it. So this one's worse. Breathe. So I like my original one better. This is why we don't just take one sample and say, ooh, we got it. Like you have to keep trying and make sure that your reading is accurate. Another thing that you can do, so I'm gonna have you pan right here. So another thing that you can do to kind of help your color Doppler is the people that are difficult to penetrate with that Doppler, so sorry, you're gonna use your frequency. So I'm gonna, if someone is difficult to get those vessels to light up, we're gonna decrease our frequency, our color frequency. My color is on, and now my frequency is here. If you decrease your frequency, it becomes more sensitive and it penetrates further. Moving your scale is just gonna make your color more sensitive, which can cause a lot of artifact. My first line of defense to try and fix that is going down with my color frequency. Then you can decrease your scale and then increase your color gain. That's the order of which I would use. There's also gonna be presets on your touchscreen for penetration and slow flow and things like that. So that was hepatic artery. Now coming off of the main portal vein right here, you can see this blue vessel coming off. That is the posterior right portal vein. So let's get a tracing of that. I'm gonna take my angle correct off so we could see that it's at 0. Small breath and hold. Breathe. So now your main portal vein, you want red going into the liver. right? We want that to be above the baseline. Your right portal vein, because your main portal vein is coming in and then it's splitting. So this right portal vein is feeding the posterior aspect of the liver. So it's going away from your probe. It's supposed to be blue. If you're getting a red tracing, that should raise a red flag for you and say, okay, is my posterior right portal vein, is it going retrograde or is it just the angle that I'm getting? So you kind of have to assess that and make sure that that's correct. So that would be your right portal vein. And now the portal vein is splitting up here. So you have your left, take a breath in and hold it. So you have it splitting. See, one's going this way and then one's going that way. So that is, breathe. That is your anterior right portal vein. And then this would be your left. Breath in and hold it again. I'm gonna do my anterior right portal vein, which should be above the baseline because it's going towards the probe. Breathe. And then you could take your left portal vein right here. You could do that. I like to get it when I'm in left lobe. I like to get it in transverse. So breath and hold. So this, see, breathe. So your portal veins are, it's the portal triad, right? So your portal veins travel with a portal vein, a hepatic duct, and a hepatic artery. They're also covered in an echogenic lumen. So I know that this is my portal vein. If I put color on, you're gonna get, breath and hold. You're gonna see that there's a hepatic artery right next to it and the portal vein. So when you're doing, hear that? You can hear the artery there, breathe. So when you're doing your portal veins, I see my venous flow, but then I also see my wall filters too. My wall filter is not correct for the arterial flow, but you can see this arterial flow faded right back here. So when you're doing your portal veins, if you're doing your portal veins, you wanna make sure that you're not picking up on that arterial flow. Breath and hold. So I am transverse left lobe right now. I see my hepatic veins up superior. I'm coming down. And breathe. And that's my left portal vein. So we've done left portal vein, we've done main portal vein, anterior and posterior right portal vein, hepatic artery, and then the 3 hepatic vessels, hepatic veins. The only other one would be splenic vein. I like to get it at the pancreas. Let's see if I can get it. Our patient is not NPO. Oh, but it's beautiful. Look at that. So I am transverse pancreas right now. So this is panc tail, body, head. Your splenic vein is going from your spleen diving into that main portal vein. So at the portal splenic confluence, we want it to go red to blue. If your splenic vein is flipped and it's blue at the tail, red at the head, that's bad. So we want to make sure that raises a red flag. Okay, is my splenic vein going retrograde or is it just the angle that I'm catching it at? So we want red at the tail, blue at the head. And our splenic vein, we want to catch it at the tail, not at the head. So we want to catch it where it's red. That's perfect. So if you're getting your splenic vein at the panc, that's perfect. We want it, again, at the tail where it's red, and we want it above the baseline. That means it's going in the right direction. If sometimes our patients are all gassed out and we can't see the splenic vein at the panc because we can't find the panc, then you would go and get your splenic vein at the spleen. Your splenic vein at the spleen should be going away from the probe, and it should be blue because your vein is traveling away from the probe. So, what?
How much, right?
Yeah, let's show them. Thank you. So I'm going to show you a sag spleen. Let me put a little more goop. Sag spleen. I'm gonna put color on, and again, adjusting my box, and we can see this vein going away from the spleen, and it's blue because that's the correct direction. So if you ever had the retrograde flow at the pancreas, you want to double check it at the spleen and make sure that it's going in the right direction. Sometimes it's just a correction of your angle. That's why you want to be conscious of which way blood is flowing, where your color box, like is your color scale flipped, you know, check a bunch of things before calling it retrograde. But that is Abdominal Doppler. Thank you so much for listening.